Here with Stephen Ondra from Healthcare Service Corporation, which is a very big Blues insurance plan, and he's the Chief Medical Officer. And you've got an amazing life story, starting with getting a bayonet at West Point, and then winding up being on the field, wind up being in the field during the first Desert Storm as a neurosurgeon.
Yes.
And then becoming part of the policy team on the Affordable Care Act before your current job.
Right.
So now you're actually in charge of being one of the companies on some of these exchanges, these big online marketplaces in 5 states.
Yes.
So how is that going?
Well, how is the exchange open and going is a question. One weekend that's a little bit early to really tell.
Right.
1 week into a major program launch, whether it's in government or the private sector, a little bit early. What I can tell you is it's been well documented. There's plenty of glitches and frustrations that some of the people that want to enroll are having difficulty. Having said that, number one, that's not a surprise to us. And number two, we are seeing measured improvement on an almost daily basis. And so we're really confident that the exchanges will be running, operational, and serving the public on an increasingly efficient way, and really people being able to meet their needs before December 15 for that January 1 start date for insurance. And also, I don't think anybody's surprised that there were some problems on a big program.
But do you think this is a big opportunity? How big?
Oh, it's a huge opportunity. One example, one of our states is Texas. The state of Texas has around 27% of the population of the entire state that's uninsured. And most of those people need and want insurance. And so this is an opportunity for us to provide access to health care in a way that they can afford. And so for us, it's a tremendous business opportunity and also a moral opportunity.
And so why do you think that you can make money off in these areas where you don't have, where you have community rating, where you're paying, you have to take the guy who's sick and the guy who's well, and you're not allowed to have the big differences in costs that have traditionally marked the individual insurance market?
So you're really talking about the lack of underwriting and the guaranteed issue, which is at the heart of the Affordable Care Act.
Which obviously you're a fan of.
Yes, I am. We think that no law, unless it comes off a mountain in stone tablets, is perfect.
Right.
But certainly it's the right direction in the right place to start on a large process of reform. The reason we think this can work is guaranteed issue is something almost everybody would want to do, but you can't be the only one to do it. Mm-hmm. If you're the only one that can't underwrite, you're going to be out of business. Once you have guaranteed issue as a larger framework, then you can create exchanges around that, and that's why the individual mandate is so inextricably a part of helping do the right thing for people that are sick, because by getting everyone in, you create a pool that keeps costs down and affordable across the population. Also, the competition of the exchanges, there has been some real evidence that it has driven down costs, certainly below what was expected.
What do you think that if this works out, that the market looks like in 5 years, 10 years?
Sure.
How big is this business opportunity? How does it change how people are insured? Well,
I think there's 2 levels to the question of how will this change the business opportunity. One is, how will people compete for that 15% of Americans that are uninsured today? The other thing is some of the business sector changes it's causing. The move to increasing consumer engagement in a growing retail market is definitely going to change the landscape for everyone in the health field, payers, providers, consumers. You start to get rid of some of the market distortions that currently exist in healthcare, and you get a discipline of value that's spread across everybody involved. And right now the payers hold all the risk. As you start to share risk through different reimbursement models and other plans that can be implemented, you actually start to get market forces working in healthcare in a way that we really haven't had, that can both improve quality and reduce costs. And you really do that through data transparency, through competition. But healthcare isn't like hamburgers either. And so you don't want to leave market forces completely alone. You wouldn't want to run a police department or a fire department on a private market. And so you want market discipline with some protection for the public at large.